Happy Friday, folks. Today I'm going to be answering the question, what are Kegels? Kegels are often called Kegels, Kegels. You can use either term. They are named after Dr. Kegel or Dr. Kegel, and what it really means is pelvic floor contraction. A Kegel is a pelvic floor contraction. So in previous videos, I've discussed how a healthy pelvic floor needs to be able to lengthen as well as contract all the way, right? So when we think about doing Kegels, we think about using it as a strengthening exercise for our pelvic floor. And in order to generate strength, we also need to be able to relax in order to be able to contract, right? So this, if you just kept contracting and not fully relaxing, we wouldn't be generating much force. So lengthening is just as important as being able to contract for pelvic floor strength. So sometimes this component is missing when we think about doing a Kegel, and I want to remind you of that, because when we do pelvic floor contractions or Kegels, we want you to be able to lift and contract through the full range of motion, as well as relax and lengthen through the full range of motion. Kegels can be done in various ways, in various positions. It depends what the desired goal is. We have, just like in other skeletal muscle, we have muscle fibers that need to be able to contract quickly. They're fast twitch fibers, and they may be recruited more in functions such as quick changes in pressure, right? So you are about to sneeze or about to cough, and you need that pelvic floor to rapidly kick in and have a pretty strong contraction to counteract that coughing or downward pressure on your pelvic floor. So for incidents like that, we may want to practice quicker pelvic floor contractions. We often call them quick flicks. So we would want to practice Kegel exercises that incorporate quick flicks to work on that, or quicker contractions. For more longer endurance holds, those are going to be recruiting more of our slow twitch muscle fibers. We might want to have longer holds with our contraction. So instead of a 1 to 2 second contraction like in a quick flick, we might want to hold these for longer, like 10 to 15 seconds. And so that would be working on our endurance. What we don't want to do, there's a many things that we can see going wrong when people are trying to do Kegels, but what we definitely don't want to do is just to maintain that long hold and not actually let go and relax. And we want to have time between each contraction. Okay, we don't want to just, hold for 30 seconds, relax halfway, hold for 30 seconds, relax halfway. We want to fully relax the muscles, give them about a 4-second rest, and then start again. So we can also play with how much of a contraction are we going to do, okay? Because not every movement, every activity is going to require 100% Kegel contraction. Sometimes it's only 25%, sometimes it's 50%. So being able to control how much you're contracting, the speed of contraction, is important for the variety of activities that we are doing in our daily lives. So to start, and even just feeling and getting in tune with how to do a Kegel and how to contract and relax our pelvic floor, I'm going to be showing you this in sitting. Sometimes people can feel it better in sitting for various reasons. Sometimes they get feedback on their perineums or on their vulva. So I'm going to show you one way with your hands. This may work for you, this may not. You can put, so you have sit bones here, these ischial tuberosities that you feel when you're sitting, these bones, and you can sit right on your hands. And I just want you to play with the breath, okay? So breathing is also super important to be able to do the Kegel correctly and really feel how your breath impacts your pelvic floor. As I've shown in previous videos, diaphragmatic breathing is essential for pelvic floor relaxation, but also pelvic floor contraction. Okay, so as you inhale, your diaphragm is supposed to drop just like your pelvic floor is supposed to drop and lengthen. When you exhale, your diaphragm rises back into your chest, and your pelvic floor contracts, and it may contract back to its resting state, or you may require more contraction, which you would exhale a little bit more intensely to help recruit those fibers. Now, we're not all walking around like blowing, but for an exercise purpose and to help recruit and engage those fibers, it's great to start this way. And even when you're just moving and changing positions, timing your breath is essential to correctly contracting your muscles. So even though we're not walking around breathing heavily and making maybe these audible sounds I might teach you, even just with normal breathing, just my pelvic floor is moving when I breathe. Okay, something to think about. So first we're going to put our hands underneath our sits bones, and I just want you to breathe, do some diaphragmatic breathing, and see what you feel. Okay. So when I inhale, I feel my two sits bones separate. When I exhale, I feel them coming back together. Okay? So your pelvic floor attaches to these sits bones. So when you inhale and it lengthens, these are going to separate. When you exhale, they're going to come back together, these sit bones. If you can't feel it that way, that's okay. That may not be the cue for you, and maybe you'll feel that later on. It's one possible way to feel the motion occurring at your pelvic floor. Okay? The other thing, if you can't feel that, you might want to change your breath up a bit and see if you can feel them coming together. Okay, so I'm gonna do it one more time. This time when I exhale, I'm going to make a shh sound with my exhale. So I definitely feel my sits bones coming together, but I also feel a lot of activity in my pelvic floor, because that really gets your pelvic floor contracting or going. Okay, so next way that may help you get some feedback, this is essentially biofeedback. You're getting feedback into your muscles. So by feeling your muscles on this towel, by feeling your perineum dropping into the towel and pulling away from the towel, we can feel the pelvic floor contraction and relaxation occurring, the Kegel. So I'm going to sit on this towel roll, place it here. Okay, now our pelvic floor muscles attach those sit bones, the side walls of the bony pelvis. They also attach up by your pubic bone and back by your tailbone. Okay, so let's play with that again. We're gonna inhale and exhale. So again, when you inhale, you should feel a little bit more pressure where your perineum is, so kind of that vulvar area going into the towel. And when you exhale, you should feel pulling away from the towel. Okay, now this is just normal breathing. Inhalation, exhalation, normal breathing. To increase the contraction phase of the Kegel, or the intensity of the contraction, we're going to change our breath. Okay, so you're going to inhale and exhale. That exhale should help trigger the contraction. Okay, now if you're really still not feeling much, you can even think there's visual cues, so you can think about closing the openings. Okay, so pelvic floor helps to contract to support your pelvic organs in your pelvis. It helps to support downward, resist those downward pressures, right? To keep our openings closed. Also needs to be able to relax so that we can urinate, have a bowel movement, open for sexual intercourse, for example. We need to be able to open and relax for these normal activities of function, okay? So when you inhale, you should feel a little bit of opening, you should feel a little bit of downward pressure into the towel. When you exhale, I want you to think about pulling away from the towel, okay? So you're actually gonna actively contract, not just breathe and see what happens. We're gonna actively contract with our breath and lift away from the towel, okay? So inhale, exhale. If you're not feeling that well, try the shh. So play with different types of breath and see if that helps you activate that contraction, okay? We can also think about activating more of the anterior area of the pelvic floor, which is the more front area by your urethra, for example, or you can think about activating the more posterior area, which would be more around your anus, okay? So play with, again, you know, it depends what your body needs. Someone may have a better contraction when they activate more back to front versus front to back. So these are just some things to think about and try. But generally you want to think about closing and lifting when you exhale, okay? I'm doing it right now because I can do it without timing my breath, okay? But the best way to do it, and especially to learn it, is to actually time it with your breath, okay? And that's how I teach people to do these. And when they're doing their home exercises, if Kegels are involved in their home exercises, I usually have them time it with the breath and time it with functional activity, okay? Because when you're out in the real world and you're picking something up, you're not always thinking, oh my gosh, I need to Kegel. You just activate your breath, the Kegel turns on, and you stay continent, okay? So let's think about this time maybe activating more the anterior portion, more around the urethra and the vagina. Inhale, I'm relaxing and opening. Exhale, I'm closing. Okay, so play with the front, play with activating more the back first. They're all going to activate. You're not really going to just isolate one specific area, but it's where more of the contraction is occurring. Or it may just be you need to, for your particular body, you may need to think of a certain area opening or closing to be activating, okay? So this is something you'd also figure out what cues work best for you if you were seeing a pelvic floor physical therapist, okay? Because also you'd be getting biofeedback either with an internal exam, with your finger. You can use a mirror. You can see kind of what's happening when you inhale. If you're looking at yourself with a mirror, your perineum should be going this way, right? When you exhale, it should be kind of coming up this way. It should be lifting up and coming in. Inhale, it's going out and a little bit down. Exhale, it's coming out and coming in. So even if you just observe yourself with the mirror and look and see, what am I doing? What is happening with my perineum, with my vulva? When I breathe, when I contract, when I relax, there should be movement, okay? Both ways. Lastly, let's talk about some of the compensation type strategies you can be getting into and that you want to avoid, okay? So often I'll see people, they're squeezing their butt really hard, or they're squeezing their inner thighs really hard. This is why sometimes when someone is about to cough, sneeze, right? They cross their legs, they move their legs in, and that's because that helps these muscles on your inner thighs help to contract your pelvic floor, right? So we'll see, cough, sneeze, cross our legs. It's our body's way to attempt to Kegel, okay? But we shouldn't be leaking with that. There are ways to avoid that, and some of that may be Kegels. It may be doing functional movement with Kegels. It may be strengthening other areas of your body so your core works with your pelvic floor. So ways that we often see people substitute for their pelvic floor that we want to avoid, that's not entirely true, because sometimes we'll have people train with maybe a towel between their knees, okay? If they're having trouble activating their pelvic floor, okay, we may have them actually squeeze a towel if they can feel the contraction more. So you can try that too. When you squeeze a towel, do you feel the contraction more, or do you feel nothing? If you squeeze really, really, really hard, do you feel it more, or do you feel nothing? Because sometimes when we squeeze too hard, the pelvic floor is not going to work, okay? And this might be taking over. So we just want a gentle squeeze and see what you feel in your body, okay? Some people this helps. Some people, they focus here and nothing happens internally. There's no pelvic floor contraction. So keep that in mind. But ways I see substitution. I see people either gripping with those inner thigh muscles. I see people squeezing their bums, okay? You should not be squeezing your glutes. You should just, your glutes should be relaxed. Your glutes should be completely relaxed, and you're just drawing in from those sit bones, and you're closing those sphincters around your openings, okay? You often will have some abdominal contraction, and that is okay. Your transverse abdominis is part of your core. It wraps around your back all the way to the front, and you may feel some contraction of those lower abdominals with the pelvic floor, and that is 100% fine. They work together. You just don't want it to be a very, very contracted and abdominals with a downward pressure, right? So you should feel the closing and lifting happening with a contraction here. It should never be a strong contraction here that causes your pelvic floor to relax or those sphincters to open, because then that would be a downward pressure, okay? So pelvic floor contracts and lifts, your abdominals turn on, that's fine, okay? And then a relaxation of everything. If you have any questions, please don't hesitate to ask at askapt@soulsource.com, or you can always drop a comment on any of our social media. Thank you. Bye.